Hi, my name is Ashlyn Najira, and I will be presenting my practice change proposal for our class Transforming Healthcare Organizations and Changing Outcomes. Patient population, problem, and plan intervention. For my practice change proposal, I will be focusing on the perinatal, postpartum, and women's health patient population. It is known for these types of patients to be readmitted for postpartum bleeding, unmanaged high blood pressure, and infection. I plan to focus on the type of education patients receive before discharge and create a care plan that continues to follow up with patient care after discharge. We have seen a rise in readmitted patients throughout all populations, and with my proposal, I believe a change could be seen. Background and significance of the problem. In the world of perinatal women's health, we see a great number of readmitted patients who have unmanaged blood pressure, significant amount of postpartum bleeding, and infection. Elevated blood pressure can cause stroke, heart failure, eclampsia, and hemorrhage. Infection is seen in patients who may be post C-section or those who were not educated on how to care for themselves after delivery. These issues are important to focus on because these patients are at high risk for maternal and neonatal morbidity. On this slide, I have listed my micros, mesos, and macros of my proposal. I have also listed which level affects my proposal the most. So for postpartum bleeding, the micro level affects it the most. The reason why the micro level is most affected because personal medical history directly influences the reoccurrences and management of postpartum bleeding. For unmanaged blood pressure, the micro level also affects it the most. The reason why the micro level is most affected in unmanaged blood pressure is because pre-existing hypertension and lifestyle choices influence postpartum hypertension. For postpartum infection, you see the meso level affected the most. The reason why the meso level is most affected in postpartum infection is because support from healthcare providers and proper education is significant for the patients before discharge. Knowledge about chosen organization. The organization I want to address my specific problem and promote my change proposal is John Peter Smith Hospital in Fort Worth, Texas. JPS Hospital is a level 1 in acute care and a level 4 in maternal care. It is located in an urban area with 582 beds, more than 25 community-based clinics, and has roughly 7,200 employees. Not only does this hospital provide a variety of comprehensive services, but it is a non-profit county hospital. Potential barriers. Although collaborating with a hospital can offer many benefits, there may also be barriers that affect my change proposal. Some of these barriers may include resource limitations, communication challenges, and institutional barriers. Resource limitations such as budgeting constraints or staffing issues can limit the progression in my proposal to improve patient readmission rates. Communication challenges may cause concern due to different women's health units not effectively collaborating to implement this project. Institutional barriers may slow down the implementation of new interventions due to their own protocols within the hospital. With the right interventions and teamwork among everyone included in patient care plans, staffing can overcome all barriers. Change theory. I believe the best theory of change suitable for my proposed project would be the change stage, also known as transition stage, found in Lewin's theory of change. The change stage is known to be a multiple-step process where a new approach is used to implement further change. I chose this particular theory because I would like to start my proposal by discussing it with my team, providing proper education for staff to implement the new plan, having staff perform what they have learned with the patient, continue patient care after discharge, and analyze new readmission rates. Quality and safety outcomes. Improving readmission rates for patients with postpartum bleeding, unmanaged hypertension, and infection can be accomplished by the following quality and safety outcomes: correct implementation strategies, adequate data collection or monitoring, and following regulatory and accreditation standards. All of these quality and safety outcomes can be done by giving the patient proper education or teaching, performing the correct research for data collections, and assuring all staff members have the proper continuation of education. This slide includes each phase of the improvement model I would like to follow. Assessment phase. During this phase, data will be collected on the readmission rates for patients who match the change proposal criteria. Next phase, cost for readmission rate analysis. In this phase, we will identify the trends related to all readmitted patients. Intervention development phase. In this, we will implement a multidisciplinary team and provide competent education materials for the staff. Implementation phase. Train the care team to implement interventions and how to address postpartum complications. Monitoring and evaluation phase. Track readmission rates and patient satisfaction. And last, the results. Analyze the results, compare to previous readmission rates, and look for ways to improve. Financial implications. When implementing a new proposal or project, we have to consider the financial aspect and the implications. The hospital has to take into consideration what the potential cost savings will be, what the cost of the project implementation will be, and the financial analysis. Looking at the potential cost savings, we look at how this proposal will reduce the readmission cost. With the potential cost of the implementation of the project, we have to take into consideration how much training, supplies, and outpatient services will cost. As for the financial analysis, before presenting this project, we would have to figure out the ROI, budget for the project, and how long it should take to see improvement using the proposal. Estimated key budget expenditures. For this change proposal, I am looking to invest in about $120,000 a year until a new plan is implemented or our current proposal is modified. This money would be used to support the DNPs, office managers, registered nurses, and more. The budget would focus on costs for managing the new plan, performing training hours, and home care for the patients. The plan would be to save about $17,000 by decreasing the number of readmitted patients. The prediction is that there will be a 10% decrease in readmitted patients in the first year. Doing this will leave our projected ROI at 16%. Projected cost benefits. Decreasing the number of readmitted patients is beneficial to the hospital because it reduces the amount of money spent on patients who have already been treated. Not only will it save the hospital money, but mortality and illness rates will decrease. A decrease in number will look good for the hospital that is implementing this plan. As said in the previous slide, our prediction would be a 10% decrease in readmitted patients within the first year, which would leave the projected ROI at 16%. This slide includes 6 implementation strategies. The first one would be enhance patient education. Plan to improve patient education prior to discharge. Second, continue follow-up care after discharge. We would create a plan to ensure patients are continuing to attend follow-up appointments and continuing self-care. Third, implement risk assessment protocols. We will have a set plan for patients who are at risk for readmission. Fourth, we'll create a interdisciplinary care team. Create a team for the patient and hold weekly meetings. Fifth, we will collect data and analysis. As the plan is implemented, we will keep track of readmission numbers. And then 6, we will train our staff. Staff will be trained on how to properly educate the patient and how to correctly follow protocol for these types of patients. Communication plan. This proposal will need a proper communication plan to be successful. First, participating staff needs to be gathered to be informed on how the proposal works. Second, the patients, which include postpartum bleeding, unmanaged blood pressure, and infection, shall be identified. Third, we will state how communication among each other will continue during this process. This would be like meetings, emails, and continuation of education. Fourth, a timeline of the proposal will need to be set in place. And finally, our feedback mechanisms need to be planned. Evaluation plan. Lastly, the change proposal being implemented will need an evaluation plan. The questions to be asked to participating staff would include the following. What change in readmission rates occurred? What interventions do you think helped the most? What barriers need to be addressed and how can they be improved? The team will also need to collect quantitative data on the new rates of readmissions. All of this will need to be included in the evaluation plan in order to have continuous improvement. In conclusion, my change proposal aims to improve the readmission rates for postpartum bleeding patients, patients with unmanaged hypertension, and patients who have developed an infection after discharge. This plan includes a creation of a care plan team, an enhancement of staff and patient education, and setting goals for targeted interventions. By implementing this new plan, I believe we will be able to see a decreased number in readmission rates. This proposal allows for significant steps being taken towards optimizing postpartum and women's health care by ensuring these patients receive the care they need.